Hi, I'm Dr. Eitan Sugarman, Director of Joint Preservation at the American Hip Institute. Today, let's talk about x-rays of the hip. So what we see here is an AP upright pelvis. So this is the first place that I start, and I get a sense of, is there joint space remaining? So you can see between the bones here that there is space between the socket, the acetabulum, and the femoral head. When you have lost that space, that is indicative of more significant joint deterioration and arthritis. The next thing that I want to look at is the shape of the acetabulum and how much coverage there is of the femoral head, of the ball. In some patients, what we call dysplasia, the socket may be very shallow, or in other patients, it may be overcovered, and that can contribute to instability on the dysplasia side or impingement. The other thing that I'll look at is the contour of the femoral head. This is a good example. If you look at the right hip here, the ball of the ball and socket joint is relatively round. More or less, this looks as it should. However, if you flex the hip up in what we call a dun view, you can see this large bony protuberance here, and I'll try to draw this for you as best I can, that is abnormal. So the contour of the bone should go more like this, but instead we have extra bone here. This is just how our bones grew and developed when we were younger. However, that extra bone can start striking into the rim of the socket in higher degrees of hip flexion, and this often is a culprit for ongoing hip pain that we see patients come in and complain about routinely.